MajesTEC-1 is a phase 1 clinical trial incorporating Teclistamab, which is a BCMA bispecific T-cell engager. Hence, this T-cell engager binds to both BCMA on the plasma cells and CD3 on T cells. In the pivotal MajesTEC-1 study, patients with relapsed and refractory multiple myeloma who had been previously triple-class exposed, that means to a proteasome inhibitor, an immunomodulatory agent, and a monoclonal CD38 antibody, were enrolled in this study. That had a median of 5 to 6 prior lines of treatment, and the results have been presented at ASCO, which demonstrates a response rate of approximately 65% and a median progression-free survival of just under 12 months. What we're presenting here is the secondary endpoints, which are related to the quality of life measures of these patients. Now, this is really important because we know that patients with relapsed and refractory myeloma have a significant disease burden which impacts upon their quality of life. And whilst Teclistamab is clearly a very effective treatment, it's important to demonstrate whether these patients also experience an improvement in their quality of life. So these patients undertook questionnaires. We used the standard EORTC questionnaires, and essentially what we found was that at baseline they had a poor level of functionality, and I think that again just speaks to the fact that these are heavily pretreated population, triple class exposed. We know that there's significant amounts of fatigue, bone pain, and poor functioning. What we found after treatment with Teclistamab was that there were significant improvements in symptom scores, predominantly with pain and fatigue. And that's reassuring that it happened in the majority of patients. We also found that their symptoms overall improved, and that was seen in a statistically significant number of patients. And what we have in quality of life scores is that you need at least a 10-point improvement for it to be significant, and we found that in about 60% of patients. We saw a trend towards an improvement in functionality, but this wasn't significantly statistic. So what we think about that is that actually, first of all, the symptoms have to improve, and then your functionality improves after that. So I guess what we need to do is to follow up our patients for longer. It's a relatively short follow-up at the moment, and hopefully we'll start to see their functionality improving as well. So we're looking forward to further follow-up on that data and really just trying to understand how T-cell engagers impact upon patients' quality of life.